Hello, this is Dr. Evie Kemp here again. Welcome back to Lesson 2, Screening and Screening Tools. So, the learning objectives for Lesson 2 are to look at how to use screening tools for stress, depression and anxiety. We're going to look at 3 tools, DASS, GAD-7 and PHQ-9. So let's start with DASS, which is the Depression, Anxiety, Stress Scales. There's a DASS 42 and a DASS 21, and the DASS 42 has 42 questions and the DASS 21 has 21 questions. The questionnaire is free, it's in the public domain, and it was created by the University of New South Wales in Australia. It's available to download here at this link, but there's also a wonderful electronic version available with automated scoring, which makes it much easier that you can just get your patients to use. And it should be used as part of a full clinical assessment and can be used in teenagers from 14 plus and adults. So this is what the questions for the DASS 21 look like. And these are the instructions. It says, please read each statement and indicate how much the statement applied to you over the past week. There are no right or wrong answers. Do not spend too much time on any statement. And the rating scale is as follows. Here it is here, 0, 1, 2, 3. So 0 did not apply to me at all. That's never. 1 is applies to me to some degree or some of the time. So that's sometimes. 2, applied to me to a considerable degree or a good part of time. So that's often. And 3, applied to me very much or most of the time. That's almost always. And you get your patient or your client to fill that in. Now, we said there are 3 scales, so let's look at them in a bit more detail. So first of all, the depression scale. So this corresponds closely with the DSM-5 diagnosis of mood disorders. That's the Diagnostic and Statistical Manual of Mental Disorders. And this scale measures dysphoria, that's a real state of dissatisfaction with life, hopelessness, devaluation of life, self-deprecation, lack of interest or involvement in life, and hedonia, that's the inability to get pleasure out of anything, and inertia. And here are some examples of some of the questions. I feel sad and depressed. I felt life wasn't worthwhile, or I could see nothing in the future to be hopeful about. And there's an important note here that suicidality must be assessed separately in your patients. This doesn't cover suicidality. And on the depression scale, characteristics of people with higher scores are that they're dispirited, they're blue, they're convinced that life has no meaning or value, they're very pessimistic about the future, they can't experience or enjoy anything in life, and they feel slow and lacking in initiative. Let's move on to the anxiety scale, and this corresponds closely with the DSM-5 diagnosis of anxiety disorders, except GAD, which is a generalized anxiety disorder. And this scale measures autonomic arousal, that's sympathetic autonomic nervous system arousal, skeletal muscle effects, situational anxiety, and a real subjective experience of an anxious affect. So examples of questions are, I was aware of dryness in my mouth. I had a feeling of shakiness, or my legs were going to give way. I felt terrified. And characteristics of people with higher score on the anxiety scale are that they're feeling apprehensive and panicky, they're trembly and shaky, they're aware of having a dry mouth, breathing difficulties, pounding heart, and maybe sweaty palms, and they feel very worried about performance and possible loss of control. Moving on to the 3rd scale, which is the stress scale. This corresponds very closely with the DSM-5 diagnosis of GAD, generalized anxiety disorder. So this scale measures difficulty relaxing, nervous arousal, being easily upset or feeling agitated, feeling irritable, overreacting, being impatient. And examples of questions are, I found myself getting upset by quite trivial things. I found it hard to wind down. I was intolerant of anything that kept me from getting on with what I was doing. And on the stress scale, people with a high score have the following characteristics. They feel tense, they can't relax, they feel touchy, they're easily upset, they're irritable, nervy, jumpy, and feel intolerant of interruption or of a delay. And how do we interpret the DAS scores? So first of all, if you're using DAS 21, you multiply your scores by 2 to get the right score. And just to say, scores on each scale can run from 0 to 56, and you'll end up with scores for depression, one score for depression, 1 score for anxiety, and 1 score for stress. And looking at this, that's the normal range, that's the mild range, moderate, severe, and extremely severe range. So that's DAS, very easy to use. However, let's move on to some other tools that we use a lot in the UK, because they're very quick clinic tools. The first one of these is GAD-7, which is the Generalized Anxiety Score Assessment 7. It's a rapid screening tool for 4 common anxiety disorders. That's GAD, panic disorder, social phobia, and post-traumatic stress disorder. It's often used in a family doctor or a mental health outpatient setting, and it's also free and it's in the public domain. And it's very handy to objectively determine initial symptom severity. It's also very useful to monitor changes in symptoms or the effect of treatment over time. And from a validity perspective, it's 70 to 90% sensitive and 80 to 90% specific across all the disorders at those cutoff levels. And higher GAD-7 scores correlate with increased disability and functional impairment. So let's have a look at the questionnaire. You can see it's a very easy questionnaire to get patients or clients to fill in. Just 7 questions, and it says, over the last 2 weeks, how often have you been bothered by the following problems? Not at all, several days, more than half of the days, or nearly every day. And then you add the columns up and you get a total score. And the other great thing about this questionnaire, there's also a qualitative question here as well, which is, if you checked off any problems, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people? So the important thing here is we're trying to understand how much these symptoms are really affecting somebody on a day-to-day basis. And they can tick not difficult at all, somewhat difficult, very difficult, or extremely difficult. It's a terribly useful question to know the answer of. And this is the scoring and management recommendations. Scoring 5 to 9, mild symptoms, probably just monitor. 10 to 14 are moderate symptoms, possibly maybe clinically significant. You need to continue fully assessing the patient. And over 15 severe symptoms, active treatment probably warranted. Just to say as well that really for panic disorder, social phobia and PTSD, the cutoff score is actually a little lower than 10, it's 8 for optimal sensitivity and specificity. So that's GAD-7, used extensively around the UK in family doctors and outpatient departments. The other tool that's used in a very similar way is called PHQ-9, the Patient Health Questionnaire 9. And again, it's very helpful to assist a clinician in making the diagnosis of depression, of course, along with a full history and clinical assessment. It can quantify depression symptoms and again, really help to monitor severity and treatment effects over time, which both the patient and the healthcare worker can find terribly useful to see whether that's going up, the scores are going up or down. Again, can be used in GP or general medical outpatient settings. And again, it's free and it's in the public domain, again, with good validity. And the higher PHQ-9 scores are associated with decreased function and increased symptom-related difficulties, plus increased days off sick and use of healthcare requirements. And here's the questionnaire, here's the PHQ-9. Again, very simple to use, very easy. You've got 9 questions. over the last 2 weeks, how often have you been bothered by any of the following problems? Not at all, several days, more than half the days, and nearly every day. And again, you've got this qualitative question again at the bottom, which is, how much these symptoms actually affected your day-to-day activity? Terribly helpful question. And again, here's scoring and management for the PHQ-9. Really, we're saying if you score 5 to 9, you've got mild symptoms, 10 to 14 moderate symptoms, 15 to 19 moderately severe, 20 to 27 severe. And here's suggestions regarding treatment. But again, it has to be part of a full clinical assessment. So hopefully you found those questionnaires to be helpful, very easy to use. Good luck with using them. That's the end of lecture 2. I look forward to seeing you again soon. Bye now.